Hello guys, welcome to my new video with the facts about another horrifying rare disease affecting the face of the patient severely. Imagine a mother gone through the exhausting labor delivering, keen to visit her newborn baby, visiting the small face lacking the whole or parts of the nose. It sounds incredible, but with the rare disease Arhinia, it becomes real. Arhinia is the congenital, partial, or complete absence of the nose at birth. It is an extremely rare condition with few reported cases in the history of modern medicine. It is generally classified as a craniofacial abnormality. Babies with Arhinia miss one half or their entire nose at birth. The nose area is flat and firm on palpation, although small ridges or small and non-functional nostrils may be present. In the vast majority of cases, the upper jaw is small and the tear ducts at the base of the eyes and the sinuses are missing or maldeveloped. Furthermore, Arhinia is often associated with eye or ear anomalies or can be associated with other problems with the face, the skull, or the brain. The phenomenon of congenital Arhinia, which refers to the complete absence of the nose from birth, was initially documented in French literature during the 1800s. Over time, a few additional cases of individuals born with congenital Arhinia, some with accompanying eye defects and others without, were reported in medical literature from the early to mid-1900s. It is noteworthy that nearly every individual with congenital Arhinia appears to be the first and only one affected within their respective families. Nonetheless, there have been a few reports of multiple cases within the same family, with one of the earliest examples being described in 1978. Two German sisters who exhibited congenital Arhinia along with eye defects were reported. As there are a limited number of babies born with Arhinia, it is difficult to know the cause of this rare condition. When it is the only anomaly present in the baby, it usually happens by chance. Arhinia can be found in babies with holoprosencephaly. Holoprosencephaly is a problem in which the brain fails to separate into two hemispheres. When holoprosencephaly and Arhinia are present together, babies are usually not doing well due to the brain problem or a genetic problem which is the cause of both problems. Arhinia can also be part of a genetic disease of which Bosma-Arhinia microphthalmia syndrome is the most common. Babies with this condition have Arhinia, abnormally small or absent eyes, and an underdeveloped reproductive system with abnormally low level of related hormones. This disease is caused by change in the genetic information contained in the chromosomes of the baby. We usually have 46 chromosomes matched in pairs. 23 come from one parent and the other 23 come from the other parent. Babies with Bosma-Arhinia microphthalmia syndrome have a change in the information in one of the chromosome number 18. Sometimes babies with Arhinia accumulate extra amniotic fluid around them during the pregnancy because they have problems swallowing. This condition is called polyhydramnios. It can stretch the uterus too much and cause labor well before the due date. Knowing this in advance, your doctor or midwife can help with decreasing the risk of an early birth. That is why most specialists will recommend regular ultrasound examinations at least every 4 weeks. If you feel that your belly is becoming big rapidly, you should contact your doctor or midwife to have this checked. What does it mean for my baby after it is born? Babies born with Arhinia as their only problem usually do well. Some babies have breathing or swallowing problems right after birth because the nostrils are absent or not functional. These babies may need oxygen or the placement of tubes to help their breathing. Because of this, it is advisable to discuss the best place for your delivery with your doctor or midwife. Feeding via a tube is usually necessary as sucking and breathing at the same time is difficult for these babies. A good eye and ear exam should be performed to check on the hearing and vision of the baby. The final result of the surgery or surgeries to create a nose will vary from one baby to the other. An orthodontic and a speech therapist is necessary in many cases. If there are no abnormalities of the brain, then intelligence is usually normal. When Arhinia is part of another syndrome or disease, the baby may have more problems after birth. How well the baby will do depends on those other problems. When brain problems are significant, babies will have developmental delay or frequent seizures. When Arhinia is part of Bosma-Arhinia microphthalmia syndrome, children require hormone therapy in order to go through puberty. The reconstruction of Arhinia is very complex, and it should be performed only by a multidisciplinary team that includes otolaryngology, plastic surgeons, and prosthodontists. The Arhinia reconstruction progress mainly consists of two parts: reconstruction of the nasal cavity and reconstruction of the external nose. Surgical reconstruction of the external nose and inner cavities should consider factors such as the characteristics of nasal growth and psychological impact on the child. Most authors agree that reconstruction can be delayed at least until preschool years when facial development is nearly completed. Internal and external nasal reconstruction is the most important treatment of Arhinia and can reduce negative effects on patients' psychology and physiology. Maxillary osteotomy with a down fracture is an important step of nasal cavity reconstruction. Forehead expansion, forehead flap elevation, construction of a nasal framework with costochondral grafts, and long-term nostril splinting are essential for obtaining durable morphologic and functional success. Thank you guys for watching my video. If you're interested in knowing more about rare diseases around the world, subscribe.